video, we want to look at the lab diagnosis of Kala Azar. So the target is to look at the lab diagnosis of Kala Azar. Okay, that is visceral leishmaniasis in old world, right? So there is direct and indirect. So this is these are the three things that we will study under direct. In indirect, you will study again a lot. So what we'll do is, first let us start off with a recap of what we have seen so far. We started off with Leishmania. We saw that it is a protozoan. It is a flagellate protozoan which lives in the blood, so it is hemoflagellate protozoan. The vector which transmits Leishmania is phlebotomys or sandfly. This is the sandfly. This is the Leishmania. This is the amastigote form, and this is the promastigate form. Mastigote. Promastigote. Amastigote. Guys, this is amastigote. This is promastigote. Okay. Then what else we saw in the last video? We saw the classification of Leishmania. So based on the diseases that it causes, in old world it causes these are the Leishmania found. In new world, these are the Leishmania found. Old world means like India, Africa, etc. New world means America, South America, North America, everything. So basically in old world you have visceral leishmaniasis, cutaneous leishmaniasis. In new world you have visceral leishmaniasis, cutaneous leishmaniasis. So we have seen that Leishmania donovani, which causes Kala Azar, it's sitting here. You can see Kala Azar, dum-dum fever. This is what we want to study the lab diagnosis of in this video, right? It also causes post-Kala Azar dermal leishmaniasis. So this is what we are trying to target, the lab diagnosis of visceral leishmaniasis or Kala Azar or dum-dum fever. Then we saw the history, geographical distribution, habitat, morphology we have seen. We also saw the life cycle pathogenesis of Leishmania donovani. So in this video we want to look at the lab diagnosis and treatment. If you remember the life cycle, this was what was taught, how in man the promastigote enters the man and it becomes an amastigote. It travels in our blood and it lives in the macrophages, giving that LD bodies. Right, LD bodies. Then these amastigotes are picked up by the next sandfly which bites the man, and in sandfly this amastigote becomes again promastigote and multiplies and all that. This much you have seen in life cycle. Then you saw the pathogenicity, where you saw that it will block the reticuloendothelial system. The spleen will become enlarged, the liver will be enlarged, the bone marrow will have lot of parasitized macrophages, the lymph nodes will have lymphadenopathy. Cachexia, there's a lot of weight loss, there will be pancytopenia, that means RBC, WBC, platelets all are reduced in number. The skin will be darkly pigmented, hence it's called Kala Azar. Most untreated patients die in 2 years because of other complications. Post-Kala Azar, dermal leishmaniasis also can be caused, where there are depigmented macules and erythematous patches and nodular lesions, etc. So now we will move on to lab diagnosis of Kala Azar. So basically Kala Azar lab diagnosis, there's direct and indirect. In this slide what you are able to see is only the direct. Okay, so under direct you have demonstration of LD bodies, culture, animal inoculation. So you have to either demonstrate the amastigote or the promastigote. Okay, in demonstration of LD bodies you already know the macrophages will have these amastigote which go on multiplying. So there will be lot of amastigotes inside a macrophage. That will be called as an LD body or a Leishmania donovani body. We'll come to that. In culture, you will try to demonstrate a promastigote, and in animal inoculation, again you will try to demonstrate an amastigote. Okay. In indirect evidence, very typically you will not show the organism, but you will demonstrate the antigen or the antibodies against it. You will show that there is that DNA or present, that particular DNA, and you will also do some tests like some serum tests. We'll go into that. Then skin test. Skin test is basically a delayed hypersensitivity test, just like a Mantoux test or a Lepromin test, right? Similar to that, you have a Leishmanian test or Montenegro test. And in the blood picture of the person, you can see that there will be anemia, pancytopenia, etc. Right? So these are all indirect. So that was just an overview of the lab diagnosis. Now let us get into the details of the lab diagnosis of Kala-Azar. Now coming to the direct evidence. In direct evidence, you will demonstrate what? You will demonstrate the LD bodies. LD bodies means something like this. That is a macrophage. What will happen? Our macrophage, this is a macrophage, let's say, when the promastigote comes, this macrophage will engulf this promastigote. This promastigote, what will happen? Inside the macrophage, it will become an amastigote. This amastigote goes on multiplying inside this macrophage. So, lot of amastigotes can be demonstrated. That is what you're exactly seeing here, if you notice. Can you see what is being shown here? This one. These are these dot inside a monocyte. These are the LD bodies. This is a neutrophil. Neutrophil also is a macrophage, right? So here also you can show LD bodies. So demonstration of LD bodies or the amastigotes and macrophages, and also extracellular, that's in the blood also there will be amastigotes. So this demonstration of LD bodies is the gold standard. It's the direct evidence for Leishmaniasis. It's the gold standard for lab diagnosis of Leishmaniasis. Okay. So you will take a thick blood film. Okay. Or you can take a splenic aspirate, which is not safe. You not exactly do that. Bone marrow aspirate or lymph node aspirate. But in old world Leishmaniasis, lymph node is not that affected. That's what they are saying. Lymph node aspirate usually in the new world Leishmaniasis they will use. You will use the Giemsa stain or the Leishman stain, and you will demonstrate LD bodies. What exactly are these LD bodies? They are the amastigotes of Leishmania. Now moving on to culture, guys. So we are done with one box here of direct. Now we are moving on to culture. Now culture, there are very specific media they are mentioning, like NNN media. NNN media which has rabbit blood. This is what is NNN media. And this one is Snyder liquid media with which can also be added with fetal calf serum. So this is Snyder liquid media, NNN media. Remember Snyder media, liquid media, and NNN, that rabbit blood agar slope media, can be used to demonstrate the promastigotes of Leishmania. This is the promastigote. So that is what is culture. Moving on to animal inoculation. So some animal torture being done here on the Chinese golden hamster or mice. You can do animal inoculation, and you can demonstrate from the nodules that develop from that smear or whatever from that nodules, you can demonstrate the amastigote. So you are demonstrating amastigote in the LD body and in animal inoculation, right? In both of them you are demonstrating amastigote. In culture you will make it a promastigote. Okay. Culture will be what and all? NNN media, that is a rabbit blood agar slope, and Snyder liquid media with fetal calf serum. If you want, you can add. Okay. So this was the direct lab diagnosis of Kala-Azar. We are almost like half is done. Direct lab diagnosis overall. Now we will move on to indirect. This is indirect. Now look at this. So many arrows here. 1, 2, 3, 4, 5. Totally 5 boxes here under indirect evidence. So let us look at serodiagnosis here. Serodiagnosis, you will detect the antigen or the antibody, correct? Are you able to see? You will detect the antigen or you will detect the antibody. So to detect the antigen, you can use ELISA. Very typical, you write standard things. You will detect the antigen using ELISA. You can detect the antibody also, but you should have the specific antigen with you, correct? To detect the antibody, you should have the antigen ready with you. So to detect this antibody, what antigens you will use? You will use WKK antigen, like Waka antigen. That is WKK antigen for Leishmania, remember. CFT, that is complement fixation test using the WKK antigen, that is White, Sky, Klangenstein and Kuhn antigen. So this WKK antigen. So you will use the WKK antigen and the RK39 antigen. It's very difficult, I understand, to remember all the antigen names. But anyways, remember Waka antigen for Leishmania. That is WKK antigen. Okay, then you have the RK39 antigen. So KKK, again K here. So a lot of K's, Kala Azar, something like that you can remember. WK, Kala Azar. So WKK antigen and RK39 antigen. Now, what are the tests that you will use? You will use complement fixation test, that something, indirect immunofluorescent antibody test, counter immunoelectrophoresis, dot ELISA, not just ELISA, this is some dot ELISA, ICT using RK39 antigen, that is rapid immunochromatographic dipstick. Okay, so whatever you can, you try to remember. At least remember the antigen names here. WKK antigen, RK39 antigen. What are the tests? Complement fixation test, ELISA, that is dot ELISA, indirect immunofluorescent antibody, counter immunoelectrophoresis, immunochromatographic dipstick. Moving on now, the first box is over, that is serodiagnosis is over. Then typical molecular diagnosis, very standard, you will do DNA probe and PCR, very standard this is. Actually they said this is still in the evolving form for PCR, right? So people, what exactly are we seeing? We are seeing indirect lab diagnosis for Leishmania donovani, Kala Azar, okay, which causes visceral Leishmaniasis in old world. Now we are done with the first two boxes. We are moving on to the third box, that is here, non-specific serum test, okay. So they are saying it is not specific in the name itself. So there are two tests here, Niper-aldehyde formogel test and Chopra's antimony test. So here you will test for hypergammaglobulinemia. See, one of the features in clinical features, one of the clinical features is hypergammaglobulinemia. Lot of antibodies will be there against RBC, against WBC. So hypergammaglobulinemia will be there. So to detect this, you will use Niper's aldehyde test or a Chopra's antimony test. Just listen to what this Niper's aldehyde test is, okay. So currently what are we discussing? We are going to go to this Niper's aldehyde formogel test, okay. So basically here you will take this patient's serum, right, and you will add formalin, okay, and then you will shake. So what you will see is some kind of a white, egg white or something like this. I'll try to show you. Looks like this egg white color. So basically this egg white color will be there. It's positive only if there is hypergammaglobulinemia. But it does not say anything about visceral leishmaniasis. Hypergammaglobulinemia is there. That means it is, that's what it is telling. It's not specific to leishmania. But in cutaneous leishmaniasis, it will be negative because in cutaneous leishmaniasis, there will be no hypergammaglobulinemia. Now we are done with this third box. Now we are moving on to the fourth box. Is that fine, guys? Are you finding it too much to handle? Just take a deep breath. I understand there's a lot of information here. Very good. So now we'll move on to the last two tests. They are not at all difficult, don't worry. Oh, we didn't cover this Chopra's antimony test. Okay, let us look at Chopra's antimony test. So in Chopra's antimony test, what happens? You will take some dryer's tube, okay, you will take serum with distilled water and you will add 4% solution of urea stibamine, okay. So you will see some formation of flocculant precipitate, indicates it's positive test, okay. This is little more sensitive than aldehyde test. Anyways, this is indicating only hypergammaglobulinemia. This condition you have seen even in multiple myeloma and all, right? So you cannot, it's not a specific for leishmaniasis, okay? Moving on, guys. Now we will move on to skin test. Skin test means this one. So basically what they will do, intradermal injection they will give of the intradermal injection they will give of the antigen, right? A very, very small purified antigen they will inject to find out whether this person was previously exposed to Kala Azar. So basically this is just going to tell that whether this person was, had Kala Azar. If he is having Kala Azar, it will be negative. If he had Kala Azar, it's going to be positive. So I don't know if I never had Kala Azar, let's touch wood, and I am not having active Kala Azar, then what will this test show? I wonder, because from the textbook that much information as of now I have not got. But what you have to understand here is in active Kala Azar this test will be negative. In if there is a positive test, it indicates that there was prior exposure to Leishmania parasite. Okay, so this is a delayed type of hypersensitivity reaction, intradermal injection. You know all this, right? It's the same thing you have seen in tuberculin test and lepromin test. So this is Montenegro test, okay, Montenegro test or Leishmanian skin test, okay. Now let us move on to blood picture anemia. Blood picture, what will be there? Anemia will be there, leukopenia will be there, thrombocytopenia will be there, hypergammaglobulinemia will be there in visceral leishmaniasis, and reverse albumin globulin ratio. There is a reversal of the albumin globulin ratio. Okay, so something to do with proteins, there is some reversal. Okay, so this was about the lab diagnosis of Kala Azar. We have seen both. This is the direct and we have seen the indirect. So basically direct, what and all we saw a demonstration of the LD bodies. We saw demonstration of LD bodies, culture, animal inoculation. These three we saw. Then in indirect, what and all we have seen antibody antigen detection, DNA PCR, non-specific hypergammaglobulinemia, skin test, then blood picture where you are seeing anemia, pancytopenia especially. Okay, so that's all in lab diagnosis. Let's move on and just put a word on the diagnosis of the post Kala Azar dermal leishmaniasis. Here there will be nodules, you know that, and you will, when you do biopsy of the nodule, what will you get? You will get amastigote form only, because in humans you will find only amastigote form, correct? Amastigote form. So you can, the biopsy material you can culture, and when you culture, what will you see? Promastigote form. When you do animal inoculation, what will you see? Again, amastigote form, right, in the nodule. So basically this is what you have to understand. It's almost the same thing as visceral leishmaniasis. Immunodiagnosis has no role, they are saying. Okay. Lastly, we'll put a word on the treatment of Kala Azar, guys. Treatment of Kala Azar, pay attention here. There is something called as antimonial compound, okay, pentavalent antimonial compound. This is what you have to write in the exam if they ask, pentavalent antimonial compound. And the examples are here. You can see this, sodium stibogluconate, okay, sodium stibogluconate injection. Sodium stibogluconate is one of the examples of pentavalent antimonial compound, and you have meglumine antimonate. Meglumine antimonate. Okay. Antimonial antimonate. So this is easy to remember, I think. Antimonial antimonate. Meglumine. So this is the one which meglumine antimoniate. And this one is sodium stibogluconate. Okay, both are injections. Other than this, you have options like amphotericin B, parmomycin, miltefosine. Okay, so options are there. Prophylaxis means how do you prevent getting this leishmaniasis? Hygiene, early detection, treatment, right? You have to reduce sand flies population. Okay. All the standard things you write, okay, hygiene, mosquito net, and all that standard things about prophylaxis you can write, whatever you have learned from community medicine, okay. So this completes the Leishmania topic. Leishmania donovani is what we have covered. Leishmania donovani is what we have covered, right. So in the next video, we will meet with a newer parasite. Okay. That's all from our side now.